A new report has found where you live can determine your risk of dying from COVID-19. 4 times as many coronavirus deaths occurred in the nation's poorest areas.
One pandemic, but 2 very different stories about its impact.
It really isn't fair. More affluent suburbs have more easier access to those resources.
What can we do, you know? We can't just stop working, stop earning an income, can't put food on our tables.
The Australian Institute of Health and Welfare has looked at data dividing the entire population into 5 groups, from the least advantaged areas to the most. It found that during the first year of the pandemic, there were 4 times as many deaths in the lowest socio-economic group than in the highest.
Your health is very frequently determined more by your postcode than anything.
The reasons why are varied. People in lower socio-economic areas are less likely to be able to work from home and more likely to have pre-existing health conditions.
It creates almost the perfect storm for COVID or any other illness to cause more damage.
A similar trend was seen in the US and UK, but unlike those nations, Australia has been spared the same human cost. The report also showed if we'd followed a similar trajectory to other comparable countries, there could have been up to 2 million cases and 45 times the number of deaths. Vaccines are now the key to preventing further deaths, and the government argues its rollout is back on track, pointing to free COVID tests and vaccines as examples of equal and accessible healthcare. But some doctors argue there'll only be an even playing field once the health-wealth gap is minimised.
Some of the health policies are still exacerbating that health divide along the so-called latte line.
A deeply entrenched divide exposed by a once-in-a-lifetime pandemic. Stephanie Dalzell, ABC News, Canberra.